news to everybody. I will let the other speakers introduce themselves as they appear. So I'm Jade Gresham. I work for an organisation called Active Derbyshire, whose focus is really on how we support and empower people to move in a way that works for them. So this session will focus on supporting people living with long-term conditions and disabilities to improve through lives through inclusive opportunities to move. So I'm going to provide a little bit of background initially onto why this is important. So Sarah, if we can whiz on to our next slide, please. And actually, as we do that, I'd be really grateful to hear who's here, who's with us. So if you can pop your name, organisation in the chat so we can understand more about the mixture of people we've got, that would be really helpful. Thank you. I'm sure that many of you who have joined today will recognise the benefits that you get from being active and moving in terms of daily lives. But just thought it was really helpful to highlight here some of the wider outcomes that we get around kind of by being active, people become healthier, happier, more connected, recognising that communities are safer, more inclusive and connected as well as the other benefits highlighted there. In terms of health and well-being, it has a massive impact across a large number of long-term conditions around supporting the prevention of disease in life as we age. So just recognising that there's a whole multitude of benefits from being able to build physical activity into our everyday lives. And Sarah, if we can move on to look a little bit into the data. So I'm going to whiz through a couple of graphs looking at physical activity levels across Derby and Derbyshire. For today, I've just got the adult physical activity data, but there are children and young people statistics that we can help connect you into if that's of particular interest. And from the data that we look at, there's two key measures that we're really going to observe today. Sarah's just highlighted the green line across the top looks on this slide at the number of active people in Derby City, and that bottom red line looks at the inactive people. So the difference is inactive people are doing less than 30 minutes of physical activity that raises their heart rate, get them slightly out of breath in terms of moderate intensity exercise. And so that's our inactive people, and the green line looks at those who are achieving over 150 minutes of physical activity, which is what the Chief Medical Officer recommends in terms of those wider benefits of health. But today really focusing on how do we support those people that are doing less than 30 minutes of physical activity to start to introduce movement into their lives, as that's where the biggest health benefits come from. So as I said, I've got separate data sets for you in Derby and Derbyshire. If hopefully one of those will be of interest. Oh, sorry, Sarah, if we can just whiz back to the Derby slide. So just as the kind of the key bit I'm going to point out here for you in Derby, if I just skip down on my own notes, as you can see, that red inactive line gets us at, it's got 31% of adults who are classed as inactive. Of that proportion of people, we know that there's 42,000 people in Derby City doing no activity at all. And in the context of today, we've got 23,000 of those people doing no activity that living with a long-term condition or disability. So if we can whiz on to Derbyshire again, Sarah. Thank you. Figures are slightly different in Derbyshire. We've got 26% of adults doing who are inactive doing less than 30 minutes, but there's 110,000 people doing no activity at all, and 64% of those people are living with a long-term condition or disability. When we think that's nearly 65,000 people, that's a massive number. If we can move a little bit further on, thank you, Sarah. So again, just to really highlight, in Derby, this demonstrates that gap between the proportion of people that are inactive and those that are inactive living with a limiting illness or disability, in terms of that gap in access to physical activity. If we can whip over to Derbyshire, Again, the difference there isn't quite as stark, but again shows that real gap in that inequality amongst those that are living with a long-term health condition and disability, or those that are living without. If we're able to move on further, Sarah, this really presents this data in a slightly different way. So the black line that we've got for Derby City highlights that's the general level of inactivity across the city. But this really starts to highlight the differences and the inequalities that exist amongst different groups of the population. Again, recognising that the second highest proportion of those are those living with a limiting illness. And obviously there will be some correlation between that older age group at 75 plus and some of those other groups that are on there. And if we can look at Derbyshire again, please, Sarah. Again, that 26% inactivity black line across the whole adult population. Again, some similar patterns with the inequalities that exist. Again, limiting illness profiling is the second highest inequality that we've got in Derbyshire, following age over 75. And I guess just to really kind of highlight and to hopefully help shape some of the thinking around this afternoon's session is we know that every individual has a different influence and different behaviour. So this afternoon's work will really try and highlight the breadth of work that we're doing across these different spheres. So not just thinking about the individuals, but how we create the environments, the policy, what organisations exist that really support people's everyday movement. And highlighted that, yeah, it's quite a complex system that we're working within, and hopefully we'll share some of the good practice that's going on this afternoon. And I think it is the final slide from me. For those of you that might be new into this work, just to really share that there is a lot happening nationally. So there's some examples on here, a national piece of work called Moving Medicine that really looks at kind of reinforcing that people are really in control of their own health, they understand their condition, and really supporting that movement in a way that works for individuals to really get those wider health benefits and outcomes. And in terms of the data and insight, that is it from me, and I'll pass over to Sarah.
Thank you, Jade. Hi, everybody. My name's Sarah Knapp, and I am the lead physical activity inclusion officer on a project which is called All Move in Erewash, which we call AMiE for short. So I'm just going to go through a little bit of background to this project and a key aspect of what we've been working on so far. So essentially, AMiE was kind of born shortly after COVID, when we could see that there were some clear disparities, like Jade was saying earlier, and some clear health inequalities between people that were being active and inactive, especially for those people with a long-term condition or disability. So the project itself, one of the aims is to try and address those health inequalities so that we can actually make that gap a lot smaller. So what we know at the moment, that what the data tells us within Erewash is that there are 10,000 people who are living with a long-term condition or disability that are inactive, so doing less than the 30 minutes of physical activity a day. So in terms of what we want this project to look like, I mean, having 10,000 conversations would be incredible, but we know that it's perhaps not realistic to be able to speak to all of those people. But a huge part of the project is around getting insight from people's lived experience themselves, and so we've had a lot of those conversations already, and those are continuing to be ongoing as we move through the project. One of the things that we don't know, or perhaps we certainly didn't know at the start, was what are the key things that do help and hinder people with a long-term condition or disability to move. And the idea of that is that we are working together in partnership. There's lots of different stakeholders that are involved in this project, including kind of healthcare professionals and people who kind of work on the ground and support people with long-term conditions. But we're keen to challenge challenge the assumptions that we perhaps make about those barriers that people have to being active. And we want to really understand what the underlying issues are for people, not just kind of assume that we know everything, because actually it's the people with that experience that are the experts in their own lives, and you know, are on their own journey to in trying to get active. So in terms of how we've kind of the approach that we've taken, so my role I came into post last September, and essentially what I've done so far to reach our objectives is kind of connected with stakeholders. Like I said, there's so many partners that are involved in this work, and we've had some really good support, particularly within our kind of leadership steering group, from the Erewash Primary Care Network, from the ICB, from Active Partners Trust, and from Erewash Voluntary Action, as well as charities like Active Alliance. So yeah, connecting with those stakeholders has been really important to kind of share the work that's going on, to support each other, to share our own ideas and experiences, and really think about how collaboratively we can move things forward. But as well as working together in partnership with professionals, like I say, the insights from people with lived experience have been a key part of this project. So I've been going out, attending community groups, talking about the project, talking about what we're trying to achieve. I've also been speaking to residents, so people that are living with a long-term condition or disability in Erewash, to understand more about what the barriers are to moving and what kind of support they actually need, and what the key issues are, so that we can really work on those and take a core focus on those things. And then as part of gathering those insights, I've sort of had a survey that was developed, which we released in March, April time. There is a report from those findings. There was some really useful and rich data from that survey, which you'll be able to find on our webpage, which there is a link to later on in the slides. And I've also been facilitating focus groups to build on the data that was gathered from that survey, and really get a deeper understanding of what is going on for people who are living with a long-term condition, and how they can be supported. So Jade's already kind of shown the onion diagram, but again, just to highlight that the work isn't just about trying to influence individuals' mindsets and attitudes, but it's actually about working across the whole system and understanding where changes can be made within different parts of the system where somebody with a long-term condition or disability is being supported, so that everyone has a part to play in helping them to become more active. So from the insights we have gathered, and particularly from the survey that was launched, and some of those focus groups, there were 4 key areas that we felt were quite essential to move the AMiE project forward. And within the scope of today, I'm just going to focus on one of these key areas, which is the workforce development. So this is something that we felt is a priority within Erewash, and something we have started to do is upskilling the workforce, to help them feel more confident and competent in encouraging residents to move. And one of the reasons that this came up as a priority was from some of the things that I've been hearing when talking to residents. And I'm just going to bring the quotes up now of what kind of things residents have been telling us. Essentially, the main things we've been hearing is that there is a common theme where there's a lack of trust, and there seems to be a little bit of a miscommunication when it comes to kind of being supported by clinicians, by healthcare professionals. So we felt like this is a really good opportunity to work alongside clinicians and professionals within the community, understand the position they're in, and some of the barriers they have to encouraging and supporting people to be more active, but also upskilling them at the same time. So in terms of the workforce development, what we've been trying to do is increase the knowledge, skills and attitude of professionals who are working in Erewash supporting these people. So yeah, increasing their knowledge so they have a little bit more understanding about how they can support people, developing their skills. A lot of these skills which probably already exist. It's probably the reason they've come into the profession, but just reminding them and reinforcing of the importance of these skills, and trying to influence attitudes as well, to help professionals think about their own assumptions that they make about moving, and their own views and perspectives around being active. So some of the professionals that we've been supporting are in those green circles there. So healthcare professionals, staff from the physical activity and sports sector, and also organisations within the voluntary, community and social enterprise sector. So in terms of what we have done, so one of the key things that has shown to be helpful is simply just sharing some of the training resources that are available. A lot of these are available online, so we've been sharing them through the network meetings that we hold, through a monthly newsletter that has recently been launched, and we've also, as a collective, we've developed an Erewash signposting resource, which is currently being updated and will soon be available on the website as well. I've also provided some motivational interviewing training with staff teams. So this has been a basic level of training. It's not accredited, but it's just to provide some tools to staff. And that's kind of come about from my own background of training to become a sport and exercise psychologist, and the kind of knowledge and expertise I have around motivational interviewing. And essentially that's been about helping staff teams to really think about the approach that they're taking when they're working with clients, to try and empower them, and to take that person-centered approach where where we acknowledge that the client is the expert in their own life, and they often have their own solution. It's just about guiding them in the right way to figure out what those solutions are. So that AMiE training is still ongoing. I've done a couple of sessions already. There's more sessions coming up. So if anyone on this call is a professional working within Erewash and would like to know more, to sign up to that training, there is a link on the slide there where you can get in touch. And then finally, we recently held a session which was for the clinicians within the primary care network in Erewash. And that was part of their Quest event, which is protected continuing professional development time that they have once a month. So we brought in an external provider who provided physical activity champion training, and basically gave some really useful examples to support these clinicians to increase their confidence and competence when having conversations with people around being active, and supporting their patients to try and fit more movement into their daily lives. So the next steps that we are taking, some of this we have started already. We are working with GP practices and having conversations with them around something that's called an active practice charter, and basically GP practices can sign up to this to show that they are taking steps to increase physical activity, not just with their patients, but also with their staff. So that's something that we hope in the near future some of the GP practices in Erewash will be signing up to. We've also just started to involve some AMiE champions into this work. So we've had a couple of people who have been happy to share their story with me, and just kind of talk about how they've managed, how they've been able to manage their long-term condition through staying active and through fitting movement into their daily lives. Even though this has been a challenge at times, even though, you know, on different days it can look quite different, but that's something that we're wanting to do more of, is encourage more people to come forward so that they can advocate and inspire others to take a similar journey. And then finally, we are looking at how we can make pathways within Erewash more effective, joining up services better, linking things in better, so that people are more aware of the support that is available, people are more connected to support that they can get, but also to understand whether it might be possible to take more of a non-medicalised approach to people's health, and particularly with physical activity. So those are the kind of next steps that are coming up as part of the project. So yeah, if anyone on this call wants to get involved with this, like I say, if you live or work within Erewash and you think this is something that's like useful for you, or you want to know more about, there are some links on the slide there of how you can get more information or how you can get involved. Like I say, we are looking for more AMiE champions, so if you're happy to share your story, have a look at that get involved form. But we also send regular updates about what's going on with the project as well. So yeah, take a look and feel free to get in touch if you want to know more. So thank you for listening, and I will pass over to Chris from Amber Valley.
Thanks very much. It's a lot of information so far. It's really, really good. So yeah, I am Chris Frost. I am the Community Physical Activity and Wellbeing Lead from Amber Valley CVS. And I've also took on the role of Community Group Mentor for Jog Derbyshire in the last couple of weeks. So as you can mention, the word community is in there, which is the heart of kind of the Get Out, Get Active project within Amber Valley. So as it says on there, the programme supporting disabled and non-disabled people to be active together. We're trying to get people with long-term health conditions, disabilities, and the people that and the kind of the least active communities out in Amber Valley, trying to get them active by doing low-level activities like chair-based exercise, etc. So it started in Amber Valley in 2020, and as you can imagine, that year, that was when the challenges started, where you couldn't get out and you couldn't get active. So we started off on the kind of the back foot, but we're still going, and we've still got funding up to March 2026. So as you can see on there, the GOGA objectives and kind of the reason that we do this, it's focusing on the inclusivity. It's trying to get people that don't do a lot of activity or none at all. As you saw on the levels of activity at the beginning that Jade was showing, there is a lot in the communities of kind of inactive people. So they're the people that we're trying to focus on. The physical and the mental well-being, as we all know as professionals, what the benefits are of physical activity. That's fine, but it's the people that are out there that they need to kind of bang that drum and tell them the message. And that's what this is all about. It's all about accessing these communities. And not only are we trying to access these communities and to get them active, we're also trying to develop the right workforce. Very similar to what we've just been saying with Sarah's AMiE work. It's about getting the right workforce to support the truly inclusive activity, including finding the right locations, finding the right places to do the activity, the right deliverers, what people need in the local communities is it's a community voices we're trying to find. So next slide, please. So the GOGA approach and why it works. As you can see, it's very kind of similar sort of visual to the onion diagram, but in the middle is the communities, happier, healthy, connected communities. That is the heart, as you can see there. It's the heart of what we're aiming to do. So you've got the kind of the four outcomes that we're looking at, the change in the attitudes, reaching the least active, improving physical and mental well-being, reducing isolation and community engagement. That's what the kind of GOGA umbrella is, but the heart of it is a community, and trying to get them to do activity, not sport necessarily. It can just be moving more and doing a bit more than you're doing the day before. So we've had lots of activities over the last 5 years, but the ones that we've got going off at the moment, as you can see, I'm stood in the same stance as on that photo, I've just realised. So the current sessions we've got, the men's yoga and the yoga cancer for recovery, they've been supported by the Belper social prescribers. They're the people that are in that photo, and the people that attend these are people that are referrals through Belper social prescribers, because they have had a need for something and it's been actioned by GOGA, it's been funded by GOGA. We've also got chair-based activity, we've got Tai Chi, we've done a run club, so I'm a guide runner and running coach, so I helped out definitely women. So I helped them out with a running club, did it SOFA to 3K. So then they can get up to that level of an inclusive kind of environment. It's safe and secure. As it Crossley Park in Ripley, it was, it was closed as a closed car park. We had sign interpreters. It's inclusive for the people that we're looking at accessing. We've also got Zen fitness classes, community boxing, and we do the wellness walks, which are through Walk Derbyshire. So the Amber Valley Walking Together side of Walk Derbyshire. So just going back onto the one that we was doing, so that with all these sessions, we wanted them to be in a community location. So they're in the local yoga studio for the photo that is on there, but the village hall, the community halls, local green spaces, we want them to be where people can access, which is local to them, it's close to them, whether it's a bus route, whether it's walking distance. We want people to have as little barriers as possible. We have fantastic resources with leisure centres, with Belper, Alverton, Ripley, Heenan leisure centres in Amber Valley, but if you mentioned we're going to do a Tai Chi session in a leisure centre to somebody that is very inactive, that's going to be a barrier in itself. You know, the fear factor, there's a stigma sometimes with leisure centres, which is not the case. But if you've never been before, walking through those doors would be a challenge. Whereas if you do it in the local village hall where they have the coffee morning and the slimming world and the other activities that are already there, people are more likely to engage. And that is what we find when we've been delivering the local sessions in the village halls. We've also been part of the wellbeing sessions that Arch Primary Care Network have been doing. So Alfred Crouch, Ripley Primary Care Network have been hosting wellbeing sessions over the last year or so. There's numerous organisations that go to these sessions. So Live Life Better do blood pressure checks, they do wellness checks, they do advice for people and support. Places Leisure are there. AMiE Valley CVS, so we've got our social prescribing network are there, and I represent physical activity as an umbrella. AMiE Valley Borough Council, the partnership. Then you have Futures Housing. There's lots of other people, the fire service, police. It's kind of a one-stop shop for health and wellbeing dropping for AMiE Valley. So we've been having these in Somercotes. We've had them at Alfreton, Ripley, Crouch, Hena. They've been at the Glebe Centre. They've been at some of the leisure centres, the local village halls. So from my perspective as GOGA, it's about promoting everything that's physical activity within the area. It's not necessarily just sessions that GOGA are hosting. If somebody says, I would like to do a walking group, I would like to do, my son would like to play football, I'd like to do, it's about listening to the voice, whether we can action it, fantastic, or if there's already an opportunity out there, we signpost them to that. And it's quite handy that I kind of live in the local area, so all the local knowledge is there, especially in the Somercotes ones. There's not necessarily ones that you could just type in on Google. It's kind of people and the networks you already know, the existing networks that you can find the right people to signpost them to. So with the picture that's there, the chair-based exercise and the activities that we've delivered is through the voice. Some of those people that are in that picture, they have come to the wellbeing sessions and have said, I would like to do a really low level exercise class in the village hall, which they were studying at the time of talking to me. And because there's a collective of people that said they would like to do it, we've actioned it. We've got one of the Places Leisure instructors doing the delivering the sessions for them, who they absolutely love. And then they always have tea and coffee and things afterwards. We've also actioned a Tai Chi session, a community boxing session that was originally in Somercotes, and we're now still got in Ironville on a Friday night. It's at 7:30 on a Friday night at the community hall. And these are from people saying, I'd love this for me, or I'd love this for my son, my daughter, my grandson, I'd like to do this. The community voice has developed and we've been able to action the sessions, which I think have been absolutely brilliant. We've signposted people to the walking groups. There's people that have gone to Somercotes, to Denby, to Hena, to Ripley walking groups, all because they've said, I'd love to do it. Is there anything in the local area? And they've been signposted. And sure enough, when I do the admin for the Walk Derbyshire, you see that the name's on there, which I think is absolutely brilliant. We've also had new members to the local football club. So I'm a football coach at Sleepmore United, which is just down the road from where the Somercotes Wellbeing is. A couple of people came and said, I'd like my sons to get involved, but I don't know where to signpost them. I've contacted the German. I've gone through the right channels. They've been contacted and now they've going to start playing in the season in September. So again, it's just finding the right people, having the right knowledge in the local community that people can access. And then the social prescribers always come, so they've had referrals as well who attend the sessions. So the social prescribing network always come to at least one of the social prescribers come to the sessions, and they've been signposting people because they can come and have a chat rather than having to go to the GP to access the social prescribing network. And then one last thing we do is something called Couch to 5X. I don't know if anybody on the call has heard of Couch to 5X before. It was created late 2021, around 3.5, 4 years ago. It's a person-centered motivational program that I go and help out with people to support people and get them to move a little bit more than they did the day before. It's based on the Couch to 5K program. So the 5X is 5 times something per week. So you could set something to do, a marching on the spot 5 times a week for 1 minute as the very first activity somebody does. It's person-centered, so the goal is set by the person, and then you kind of almost work backwards of what can you do now, what are your barriers, and then you develop the program from there. So over the last 4 years, nearly, there's over 150 people have been supported by myself, and they include somebody who wanted to build the stamina up when they wanted to walk from the car park of the restaurant to from the disabled bay over to the 20 yards over to into the actual restaurant because they was embarrassed when they was out of breath when they was going to see friends. So all it was for the first 12 weeks was marching on the spot, getting up, stand, doing the chair-based exercises that you do from the kind of falling network, sorting out some YouTube videos, 5-minute chair-based exercises, just trying to build up very progressive low-level stamina with somebody. And it got to the point where he says, yep, I've tried it now, I can do it, fantastic. Changed his life. There's people that wanted to walk around the shops unaided. A lady wanted just to be able to do a Christmas shopping. This was in October. She wanted to do some Christmas shopping sort of November time. She just wanted to be able to walk around, but she was struggling. She'd had sepsis on numerous occasions and was fearful of going out. Again, worked with her, and then come beginning of December, she went and did all the Christmas shopping around Morrison's and Home Bargains in Belper. B&M in Belper. There's a gentleman who wants to go out walking after stroke. Again, it's the people I speak to have got a very lack of confidence. If the referrals are coming through the social prescribers, there's a reason why they have been referred. A lot of people have had issues all the way through kind of COVID, or the confidence is the key with a lot of people. And what I found with a lot of people is you just build the confidence up week after week. It's not linear. You don't have to do a bit more every week. Sometimes they struggle because of life's challenges. So then you just have to rein it back. It could be you're working with people for several months, but in the end, they will complete their goal as best to their abilities. And then there's a lady who wanted the confidence. She loved the idea of going to the gym. She had a lot of her friends go to the gym and go to the classes. She didn't want to walk through that threshold, which I was saying earlier on. She was a little bit frightened of doing that. So started working with her, did some exercise at home that she would do in the classes at the leisure centre, so she could be familiar with. It's not the kind of unknown once you walk in. Once she knew she was able to do them and she'd be confident enough to undertake the class, I went to the gym with her, introduced her to the staff, and then she went off and she's now been a member for over a year. So again, it works just almost a little bit of a handholding situation with some people, but it's the unknown of you can do this. It's you can do this, but all you need is that little bit of confidence. And sometimes I'm just kind of the hypothetical hand on the shoulder to get people active. So some of the examples very briefly. There was one gentleman that said he hasn't got time to exercise in a week. He was adamant he was very busy. We're all busy, but you have to kind of slot it in. So created a diary, got him to incorporate what he did in a week, went back the next and reviewed and tried to map out a week for him to try and see where he could fit activity in. And actually there was large proportions of a day where he could just do 10 minutes of exercise, just whack on a Joe Wicks exercise or whatever he could find out which he enjoyed, and it got him started. It was almost having somebody going, you need to fit it in there. And then it started. We did have some Goga exercise cards, which was lower leg. There was cardio, there's upper body, and was handing these out to people. So they'd say, right, I want you to do this one this week. Next week, you want to do this one, but you want to do 2 sets of 12, and then you're increasing it as the weeks go on. And one thing I have found, and I don't know if anybody's used it in the past, but the YouTube is a phenomenal resource for seated exercise, for chair-based Zumba, for any physical activity. One of the stories I always use is a lady in her mid-80s who wanted to just do a little bit more. She fell in love with chair-based Zumba, which we found on a telly. She had Sky Q. She didn't realise you could press for voice control to open YouTube, open chair-based Zumba. Within 30 seconds, it was on the telly. Every morning for the next month, she was doing chair-based Zumba, and she absolutely loved it. And it was all because she didn't know that resource was out there. She thought she was just going to do kind of seated exercise, very basic things. But in the end, she fell in love with this video, and she did it day in, day out, which is phenomenal. And then another one is the walks, exercise class and gym visits. If somebody says, I'd like to be able to just go out for a walk, but I don't have the confidence, I can go walking with people, short little walks around the block. Just make sure people, are confident on the feet. Exercise class I have been to, it sounds an ideal job if I'm honest when I describe this to people, but I've been to exercise classes with people, the chair-based as a first time, just to get them through that door, to make sure it's not, it's not scary. There are people of that level in there, and it's the same with the gym. The unknown for a lot of people is, I don't know what the gym looks like, I don't know what it'll be like. If you guide them in and show them that the gym is actually full of people that aren't, big muscular people, actually, it's not that bad. Oh, I'll give that a try. The one lady I went with, their own machine, the cross trainer, she loved it because it was very low level, but she didn't realise what the machines were. All she saw is she sees people coming in and out and go, oh, they look really fit, and it's that unknown of what it's like inside. But going in for the first time with some people, I think there's probably at least 20 people that I've worked with that are now regular gym members because of just stepping through that threshold with them. And the referrals that I've had for the Couch to 5X it's for the last few years, it's been through the social prescribing network of Belper and Arch. So Alfreton, Ripley, Crouch and Hena have been the Amber Valley social prescribing network. I've had the technically structured physios from Ripley and Babington hospitals, usually the outpatients that are kind of on the end of the journey that have come, and I've kind of introduced them to the gym, going to the walking groups or whatever services we've got out there. And recently had a few referrals from the community health service as well. And we are looking through the Walk Derbyshire engagement work we've been doing in Amber Valley, videos and exercise things as for cared for and housebound as well. So it's not just about people that can go out and do things. It can also be people that want to do some physical activity but don't know where to start at home. And the key findings, as I probably kind of scratched upon once I've been talking, is it's that fully inclusive approach. What do you want to do? What do you want to achieve? It's all well and good if, like, for example, a Couch to 5K, that's your goal. That's what the end of the goal is. Whereas if you say to somebody, what do you want to do as a goal? And if it might just be, I'd like to be able, one of them was, I just want to be able to crawl around on the floor with my grandkids, because I can't do it because my back hurts. I've not been able to do it. I've had a hip replacement. I just want to be, and quite literally, I just want to spend 30 seconds on the ground with them. That's their goal. If you set that as their goal, they're more likely to engage with it. More people are going to engage with things that they want to do rather than being set by us, being set by other professionals. It's about them. And if it's about them, they are more likely to go, you know what, this is for me. The confidence that people have seen is incredible. You speak to people 6 months down the line to have a catch up with them, and they've gone to new exercise classes, they've gone to club-a-size, they've gone to a coffee morning down the road in the local church, they've been to all these different groups that 6 months ago they wouldn't even open the curtains very much because they were so lack of confidence. It's just they built this confidence up by, I'll give this a try, I'll give this a try. That almost unlocks for some people, well, if I can try that, I can try that. If I can try that, and it develops, it snowballs. It's that snowball effect. Understanding the barriers, I think, has always been key. I think that is what the first kind of few weeks is. What are your barriers to, a lot of people with the long-term health condition and disabilities will say, I can't because I have this. But then towards the end, it's I'm living with, but I can do this. The mindset starts to change. And that's because you are working to them on their wavelength and on their level, that to understand what their barriers are and understand what the key issues are and how you're going to be able to help them with that. And then just understand the end, I mentioned earlier on, it's just about that linear progress. It's like any journey, with fitness journey, with running, with you do the gym, of any form of exercise, you don't just get faster and faster and faster. You don't get stronger and stronger. It might be that you have a really off week, you link back to kind of the spoon theory. You might be wiped out by doing that. So the next week, I'm not going to be able to do anything. And that's absolutely fine. You're not working with these people to say, in 12 weeks' time, you're going to do this and that. You're just going to do more and more of it and you'll be perfect. It's about finding out what the issues and the barriers that people have and working with them rather than against them. And if someone needs to have a month off from it because it's too much, that's fine. You could start again. It's just about doing that little bit more each week. And I think that's me.
Thanks, Chris. Hi, everyone. I'm Katie. I am the Senior Physical Activity and Health Coordinator at Derby City Council. I think on a time frame perspective, I think I have about 3 minutes, which I think is quite a tall ask. So Joe's going 10, so I think I'm okay. Thank you for joining us today. I guess I just want to share from the offset that I don't have a set project that I'm talking about. I am merely just sharing a journey that I've been on with some people that live in Derby City that have a visual impairment. If you can move to the next slide, please, I'd be grateful. So I just wanted to share some of the groups and the individuals that we've been working with, and even from the Sight Loss Council perspective and our deaf and visual impairment services, we have people in those departments and places that have lived experience as well. So we are definitely speaking to people that are really open to sharing their experiences so that I can understand what actually needs to happen in reality for them to find ways that move more in a way that work for them. If you can go to the next slide, please. Because we are working with a really small group of people, I wanted to really focus on what's practical and achievable. And I've listed there the three areas that we're focusing on, but I think what was really fascinating is we have a lady, and she is pretty much blind now, and she said, I don't feel safe to walk indoors, let alone even have a conversation of how I do that outdoors. And I think that's just so critical to remember, that the landscape that people are working with, the levels of confidence that Chris has shared, they do sit really differently for everyone. And I think it's really important that we're meeting people where they are in terms of what they need, and we're just creating that space for them to be able to share things. So they're the three things that we're looking at. Next slide, please. So yeah, just some sharings, I guess, that we found so far. Having access to a sight buddy and how powerful that is for people has been really, really critical in the conversations that we're having. And I'll talk a bit more later about what we've discovered around that. But also the ability to familiar yourself with a place before you do any doing. And we've been in community settings, and some unique community settings. There's a supported living facility that has this secret gym inside it that no one knows about. And actually, the first thing we did was, let's go scope it out together. Let's see if this could be the place. And normally, I would say people are going for the big, high-profile places. And in the city, we've got Moorway Sports Village, and everyone's like, let's go there. And actually, it wasn't let's go there. It's let's go to this tiny little beautiful room that's got 6 pieces of equipment, and I can get into really easily and pay a donation. So yeah, you can all read for yourselves, I guess, the other factors that enable people to move more. But I think that I don't think it's anything new that you've probably come across, but just think important to raise the profile of. Next slide, please. Yes, this came across really strongly around what hinders people from moving more. I had this beautiful conversation with someone with visual impairment, and they said, I went into a space and I asked if I could swim, and they said, we don't have anything for anyone with a visual impairment. Now, it broke my heart a little bit, because actually there was a lovely swimming pool that they could have accessed, and part of me wishes that the conversation had continued and go, what would you need to be able to swim here, rather than, no, I don't have anything for anyone with a visual impairment. And that's something that we're working with the spaces and places that people with a visual impairment would like to actually spend time in and gravitate to. But something that, and you know, this is not a judgment on the staff working there, but a little tweak of the conversation, I think, could have been really powerful and enabling for the person that was trying to use their space. If I could have the next slide, please. So yeah, what are we learning? In my experience, I don't think we are bold enough to say this venue is not meeting this person's needs, and I don't actually think it can. And there are some gyms in the city where the colour of the flooring and the colour of the gym equipment, for example, are not contrasting enough. So that is out of the question for the people that I have spoken to from an engaging perspective. And I think it's okay and a little bit brave to go, okay, not the right place, let's find out where the next one is. So I think that's been really interesting in terms of that. And the people I'm having conversations with, they've also said what can help me can actually hinder someone else. And again, I think it's okay to say that. And what came in really interesting for me is there was some sight buddy training delivered in the city, some this year and some last year, and I sat in that space. And whilst it's great that there are loads of people ready to respond to anyone who might want to engage with them, what we're missing is we didn't know where they wanted to actually go. So we've got loads of people trained to be site buddies and not necessarily anyone that like they know who to kind of connect them to. So I think it's really important that we're focusing on, let's understand the environments and spaces people want to actually hang out and gravitate in. And then we can be really specific with what we need to respond with, rather than hoping that we're reaching people that we might like to. Next slide, please. Yeah, so some key discoveries. There are loads of physical activity providers ready to engage, but I think what's really important is we are connecting them to people with lived experience. They can have their own dialogue. Like, we don't always need to be that middle person kind of getting involved. Sometimes we do, but other times it's like, here's Sandra and here's Sarah, and do you know what? You guys can go and have that conversation and make sense of things together, because there's a real willingness on each side. As I've mentioned, I think it is really hard to be truly inclusive, and recognizing that we can't meet a need sometimes just helps us to move on to where we can actually meet a need. And as I've put below, in the absence of the ideal, what can we do? Because we are never going to have an ideal situation. So I think that's really important. And we had really interesting dialogue with the people that I'm working with around, right, we found a space. Let's take the community gym and the supported living facility. We found the gym, we scoped it out, we spoke to the venue, we've got everything in order. I'm like, we're ready. And they're like, oh yeah, we've got to do something. And I'm like, yeah, we politely you do, because all these have been done. And actually now we need to understand, you know, what does it look and feel like in reality, and how do we drive things forward? So I think we sometimes maybe shy away from saying what is the role we are all going to play. And I think particularly working in the council, people sometimes expect us to do all the doing, and then if we haven't done it, they're like, well, you said you were going to do this. Whereas actually what's really interesting in these conversations is, what is the role that we are all going to play? I'll do this action, you can do this action, and together we will drive things forward. Could I have the next slide, please? Because I can't remember how many I've got left. So I spoke about the gym location, so I don't need to kind of go through that again. The site buddy training is where my interest has really peaked. And if we go back to Moorway Sports Village, there are literally hundreds and thousands of people accessing that site every single day. And there are people, I've got a lady who desperately wants to swim. And so I was like, well, I feel like maybe somewhere, someone that's regularly going to Moorways might actually just want to go with this lady so they can swim together. So that is something that we are exploring with Moorway Sports Village, because I do think there are these incredible potential site buddies that we just don't know who they are yet, because we haven't had a chance to have that conversation with them. They probably don't know that they could be a site buddy. Because who normally comes up and says, oh, you swim here every day, could this lady come with you and you can go and have a cup of tea if you want after? I just don't know who's having that conversation. So that's kind of what we're driving forward at the minute, just to see, can we really quite simply pair some people up together that have this similar or same interest and do something joyful together. Next slide, please. I think I'm nearly there. Yeah, how has this dialogue been able to be had? I'm in a really, I think, luxurious and beautiful position. I get to take the time to hold spaces to listen to what people with lived experience would like to say, like to explore, and that is a really like privileged space to be in. I think it's really critical that we're keeping the communication channels open and having that feedback loop to go, I heard you, I've gone over here, and then because of that, we've gone over here, and oh, do we need to think about this again? Have we forgotten this? And I just think that I hear a lot in communities that, and with people, you came and got the information and they left again. No one came back. So it's really on my radar that we need to keep going back and need to keep going, oh, look, we were over there. And now look, we've got over here. And that's all because of the things that you were doing together with us. And as I mentioned before, there is a role that everyone can play within the journey that we're going on. And I think it's just really important we can all say in the moment, I can do this bit, I can't do this bit. And if that's what we need to say, that's also absolutely fine. And I think I'm definitely someone, I go where there's energy. So where is there passion and where's there desire? I think that's really powerful, even if it's from a really, really kind of tiny perspective. I think that's it for me. Yes. Okay. I think that was a little whistle stop tour, but thank you for letting me share my journey. I'm going to hand back to Jade.
Hello, and you did perfectly on your 10 minutes, Katie. So I appreciate there's been a lot of information there, and I found it fascinating and really great to hear, particularly kind of the experience, how the lived experience is really helping to shape and inform the work that we're doing. So we are a little bit tight on time, but we would love to hear back from all of you in the room. There's a couple of questions. We are going to do that through a site called Mentimeter. So before I swap with Sarah and stop sharing, let me, probably the bit I haven't done that would be really helpful. Let me see if I can get the Mentimeter chat link for you all in the chat. If you have phones and want to do it on there, please feel free to scan the barcode and have a go. If not, if you visit menti.com, you can also use the code that I've just popped in the chat for you. So Sarah, if we have a go at swapping screens as people hopefully find their way to join us on Menti, let me find my window. And we've got a couple of minutes to hear back from all of you. So hopefully I'm now sharing the right screen, and I will pop that into presentation mode. So let's go back to a key question. So if we just spend the next 2 minutes, I'd love to hear from you what's really stood out to you today in terms of those messages that we've heard. It will help us to reinforce in the information that we're sharing with colleagues, and in terms of that influence that we're trying to enable to support more people living with a long-term condition to move more. What's felt important from your experience would be really, really helpful to understand. So hopefully, as I can see responses coming in, so can everybody else. So yeah, so lots around that person-centered approach, that lived experience really starting to emerge. And hopefully, as we start to fill the screen, I can scroll down. So yeah, some recognition around the large inequality that we've got around those living with long-term health conditions. And I should share, because I know it was flagged to me before we started, I believe that not everybody on today's call will be able to participate in Menti. So we are going to leave this question open, and hopefully with Mark, we can share the link again kind of through the invitation. So this page will stay open till next Wednesday around lunchtime. So if you can't get in today, you will have the opportunity, if you're watching back or not able to access right now, to add your thoughts as well. Or please feel free to use the chat on Teams if you are live with us at the moment. So I will keep scrolling. Oh, I've gone the wrong way. I'll stay on this question for a little bit longer. So I think we've heard from about half. So there are still things coming in. Please, I will leave it open for another couple of seconds. So yeah, and that care and empathy has felt really important. There's a few comments I've spotted in the chat as well around the approach that Chris was able to share with people. So that's been really helpful. Thank you. Ooh, and lots, it's still coming. Oh, I'm breaking Menti now. I'll stop pressing buttons. Definitely breaking Menti. Right. So so that we don't run over the session, I will move us on to our next question. Is really keen to hear from you. Obviously, we've not had time to talk about the whole of Derbyshire. There's just been a few stories that we've heard, but appreciate some partners here, individuals might be from other areas of the county. Is there anything else that you're aware of that people on the call might want to hear more about, connect into, or if a future session was to happen that might help to kind of really highlight some local stories, please feel free to add. And I think we've got probably about 45 seconds before we need to close this window, so we can hand back to Mark before the session finishes. Okay, there's not as much coming in, so that's again really helpful insight in terms of what we know about again, in terms of those opportunities, how do we help to raise the profile of what's happening? So thank you for that. Sarah, could I ask you to pop the slides back up? And we've just got a couple, well, I think 2 more slides, Mark, before we hand back to you. And if we could move on to the next one. In mine, there we go. Perfect. So just a couple of signposting opportunities here for if this is a new area of work to you, you want to delve a little bit more and see what support is out there. These were 3 places. There's many, many, many more. But We Are Undefeatable is a national campaign that's supported by a large number of partners, including the Richmond Group of Charities and Sport England, and really starts to tell the stories of individuals living with long-term conditions, moving in a way that works for them, and national advice from those Richmond Group of Charities and other partners. Moving Medicines has been mentioned a couple of times, is a portal particularly for healthcare professionals, having conversations with individuals in the community, support about how some of those conversations might be structured, signposting to training and other sources. And then the final one at the bottom of the page is some direct signposting sources to activities or advice around physical activity offers across Derbyshire and Nottinghamshire. In Erewash, we have a slightly adapted version of that that's very Erewash specific. And Sarah, I think the last slide from us, please. Here's just the key contact details. I know mine aren't on there. I don't get directly involved in the day-to-day work, but you can reach me through the page that I put on the first link. But here's the key contacts for Chris, Katie and Sarah if you're involved in local work and want to find out a little bit more. And possibly with about 30 seconds to spare, Chris, Mark, if I hand back to you, please.
Yeah, wow, that was amazing. It left me feeling all positive and excited for everything that is going on. It was really, really great. So for the Q&A, let's go through as fast as possible. Luckily, unluckily, depending on how you look at it, we do have one question in the chat, which I'll get to. If anybody else has a question, please put it in the chat or raise your hand using the bar at the top. So the question is from Nikki, and she asks, how do you all overcome the client's personal barriers of financial cost of the parking, travel expenses, ongoing classes costs if applicable, and the fear of losing PIP if found out, in commas, that they can help themselves do more?
I might nominate Chris for that one, but we will probably all have a slightly different response.
I think, yeah, I've replied, I think, to most of that. I mean, the main issue we get, the key is with the PIP. People say, I don't want to be seen out walking. I don't want to be seen out trying to be active. If I'm seen at an exercise class, does it mean I'm going to lose my PIP? It is a big fear factor for a lot of people. And ultimately, people need to try and be more active. I say I can discuss that a bit further off this call. With all their GOGA sessions, as I mentioned in the comments, they are funded, so the instructor costs, the room and everything's funded by GOGA to try and get as many people to be able to access them as possible. And all the locations that we have, all the GOGA sessions have all got free parking as well. So there's hopefully the only kind of barrier that people have got is either the bus to get there, if they haven't got a bus, a bus pass, but everything else is free. We try and get as much people. As many people there as possible.
Excellent. Does anybody else have any questions at all? I think a lot of the session was just highlighting great stuff. So it's not necessarily going to drop questions. I think one of the biggest things we've done is a lot of networking. So of all the presenters, anybody from the other organisations and anybody that wishes to volunteer for anything, please take a look in the chat. Make sure you interlink. If you have any further questions in the future or difficulties linking up with people, please feel free to email me at ddicb.inquiries@nhs.net, and I'll network for you or I'll make those connections, no problem whatsoever. this being the case, what I'll do is I'll bring things to a close. So first of all, again, wow, this was an amazing session. I really loved it. I'd like to thank to all of our presenters, total professionals and total saints as well. I'd also like to thank the BSL interpreters, Emma and Sebastian, for their efforts today, but mostly I'd like to thank the audience. We couldn't do this without you. We do this for you, and we can all do amazing work together. Please look forward to today's video. Will be uploaded to YouTube, and there will be a Q&A uploaded onto the engagement platform. Both of those will be enclosed in the email, which I'll send you probably later today, which also has a look forward to the next session of the Derbyshire Dialogue, which is going to be on the 17th of September, and that is on the subject of neighbourhoods, and further details about that will also be in my email. So once again, thank you very much to everybody today, and goodbye.
Thanks, Mark.
Thank you very much.
Thank you all.
Thank you, Mark.